Good afternoon. I would like to thank very much Professor Yoon, Professor Khan, Professor Nguyen, the leaders of the Vietnamese Urological Nephrology Association for giving to me the opportunity to be here and to give regards from European Association of Urology that would like very much to collaborate and provide several support to Vietnamese young urologists. Next slide. I continue here. This? Yeah. This one. Thank you. So, varicocele is a mystery. Thank you. Varicocele is a mystery. We don't know many things. Why left varicocele affects left testis? We don't know why left varicocele affects right testis. We don't know why left varicocele affects left epididymis. And very few in this room know why left varicocele affects right epididymis. Also, the effects of varicocele on sperm physiology and immature sperm physiology, like spermatid physiology, are not well known. Spontaneous varicocele in Earth, our planet, two species, human species and ram. But to study better the effects of varicocele, we need research and experimental models in the experimental models of varicocele in the rabbit, experimental models of varicocele in monkey and in guinea pig. And how to take information for varicocele pathophysiology. If we have a rat running, how to make the rat to suffer from varicocele to study varicocele pathophysiology. We go to the left renal vein, we put a partial ligation, we ligate the anastomotic branches of the internal spermatic vein, and we create dilation of the left testicular vein. So this is the control rat, renal vein, left internal spermatic vein, like the human, drains in the renal vein. And the varicocele model is successful because you see very dilated the left testicular vein. So we have a model and we can study varicocele physiology. And why left varicocele affects left testis? Many theories: increases in testicular temperature, insufficiency of the hypothalamo-pituitary testicular axis, some hormonal systems change. When I was student, I learned low oxygen pressure in the testis. Research break barriers. If we have low oxygen pressure, we need to have low lactate because the biochemical cycle of Krebs goes to the lactate formation. But lactate does not show this finding, so there is no ischemia in the testis. Initially, there is a metabolic effect in the varicocelized testis, and when I was PhD student, I learned retrograde flow, adrenal gland, renal vein, internal spermatic vein, testis. This is invalid. We reject because rats with varicocele and left adrenalectomy don't show any changes. So these experiments demonstrate that this theory 10 years ago was demonstrated is not correct. Reactive oxygen species play a role, and cadmium accumulation in testicular blood plays a role. However, our research efforts in Japan and Europe have generated a new theory. Varicocele means increase in the venous-end testicular artery, testicular vein, capillaries, high pressure at the venous end of the capillary. So decreased reabsorption of fluid. So increased extracellular edema. So lower capacity from arterial place of the capillaries to have appropriate exit of oxygen glucose. So this is an exciting new theory for varicocele pathophysiology that shows a change in the extracellular fluid hydrostatic dynamics. And after varicocelectomy, the pressure decreases because we ligate the veins, better reabsorption, and better exit of nucleus, and better oxygen exit, better glucose exit, better nutrition of the capillaries and the testes. This is a very important theory because few people in Europe and maybe in Vietnam know the answer to question why a man with varicocele in your neighborhood, near your house, has 1, 2, 3, 4, 5 children with sexual intercourse. The other person in the next house has 3 million spermen, oligospermic, and the famous actor in YouTube, Tom Cruise, said he became azoospermic from varicocele. Why some men to be fertile and some men to become azoospermic? Same disease. This theory gives the answer, because if a man with varicocele has very good lymph vascular system, you have alleviation, improvement of the high pressure in the extracellular fluid, so the pressure decreases in the venous end of the capillary, and this man is lucky to have varicocele and 2, 3 babies with sexual intercourse. Now, the effect of varicocele when I was medical student on the right testes, my professor asked me why the left varicocele destroys the right testes. Because if we have azoospermia, the right testes should be destroyed. Everybody agrees with me. But the old theory from Belgium, Comher and Vermeulen, famous professors, saying that there are anastomosis between left testis, right testis, left testis, right testis, and bad factors, detrimental factors come from the left testis to the right testis and destroy the right testis. But this theory is not correct. This is why we need research. And you, the young boys and girls, should love research. Because when we examined the anastomosis, they referred only to superficial system of blood supply, not to the deep system, not to the deep venous plexus system. So therefore, we say clearly that this mechanism in all textbook and Campbell Urology 10 years ago is not correct. And our efforts from Japan demonstrated a new mechanism. Left varicocele. What is left varicocele? Dilation of left testicular vein. There is a central reflex in the spinal cord, and the dilation of the left varicocele, of the left testicular vein, often induces dilation of the right testicular vein. And if you evaluate humans with varicocele, rats with varicocele, monkeys with varicocele, the temperature increases not only on the left testis, but also on the right testis. So I have written a book, When the Left Testis Suffers with Varicocele, the right testis cry as well. We have problem also in the right testis. And very often, if I ask later the leader of our andrology, Professor Chung, how many cases of left varicocele your excellent group in Ho Chi Minh City see right varicocele, he may say, maybe often. We can discuss it later. So left varicocele often is accompanied by right varicocele. However, why also epididymis has a problem? Because when I examine residents in urology, I ask the question, the epididymis receives testosterone from where? If the resident says from the blood, like the liver, like the pancreas, like the brain, like the heart, I'm a bad professor, I don't give him the urology license. Epididymis receives testosterone 80% from the testes. And if intratesticular testosterone decreases, intraepididymal testosterone decreases. And if intraepididymal testosterone decreases, epididymal sperm maturation is not appropriate. So this is important because you don't see only sperm concentration low, but you see also sperm motility because of the dysfunction in the epididymis. And epididymis, this is from our microsurgery group in Japan, is very important for the improvement of motility, and also the right epididymis dysfunction because testosterone in the right testis decreases. So also epididymal maturation process decreases. Definitely oxidative stress and sperm ability to penetrate the oocyte decreases in human and animals with varicocele. However, many years ago, I have 2 Italian fellows in my laboratory in Japan, and they prepared the rabbit varicocele model. And they found that the father of a spermatozoon, the round spermatid, has also dysfunction. So varicocele affects the cells above spermatozoon from the stage of round spermatid. So from the stage of primary spermatocyte, protein synthesis is not appropriate, spermatid, dysfunction, secondary spermatocyte. So varicocele alters all the pathophysiology of the testis. However, yes, mysteries in varicocele. Varicocele is a mystery disease because we don't know to answer several questions. We discussed the first issue. Some men with varicocele have normal sperm physiology, some are azoospermic. Some men with varicocele after varicocelectomy, You do varicocelectomy, many physicians. You don't expect everybody will improve. Some will improve, some will remain stable, some will decrease. We discuss later if the testis is an orchestra. The music is the testosterone, and the dancers are the spermatogonia who dance to become spermatozoa. We have dancing of cells in the testes. Who is the conductor? Sertoli cell. If varicocele affects Sertoli cells detrimentally, the music is not good, we don't have spermatozoa, the man comes with 5 million of spermatozoa per ml. 2 years later, post-varicocelectomy, he may be azoospermic. He says, Professor, I came with 5 millions, no improvement, deterioration. So the good urologist should inform before operation if you have irreversible Sertoli cell damage. Although you will undergo operation, you will decrease, and I am not responsible for this. As you see, in Vietnam, the group of Professor Chung and Kênh give me very good food, but means I will never have varicocele. Never. Fat is bad for the heart. Fat is bad for the lung. Fat is the best medicine for varicocele. Nikolas Sofikitis. But it is the fat that helps the blood to go up. So this is another mystery why obesity gives better sperm parameters than thin people with varicocele. And which is the profile? Think of your patients. You have here Mr. Tuan with varicocele in your outpatient clinic. He is thin, he is tall, and he says, my hobby is to lift weight. So no retroperitoneal fat to help the movement of blood. So very quickly, varicocele increases testicular temperature, reduces intratesticular testosterone, decreases the conductor ability, Sertoli cell, to do a good music in the orchestra, defects in epididymal sperm maturation, low motility, low concentration, we have low fertility. And finally, varicocelectomy changes the blood hydrostatic parameter and improves testicular temperature and improves spermatogenesis and maturation. Thank you very much for the first part. Let's go to the second part to see what happens on the other side.
And you continue at the
Yes.
lecture?
Thank you, sir. Yes, let's continue. So today, if I ask you, what did you study in medicine? You will say varicocele affects biochemistry and cytology in the male body. Today we will speak for some revolutionary ideas. Varicocele affects the woman. Men varicocele affects cytological effects in the female reproductive tract. And if we go back, previous experiments in rats with chronic renal failure, bad sperm, fertilization, embryo, low quality to implant in the uterus. Same way, model of cryptorchidism in our laboratory, bad sperm quality, primary testicular damage, low embryo quality, low capacity to implant to the uterus. And we did a revolutionary experiment. We created varicocele to the rats. We discussed the methodology. And you see the embryonic quality is not good. Good embryonic quality, this is an embryo of 4 days, means blastomeres of equal size. What equal size? Very small size, moderate size, big size. This embryo will never become a baby. And the reason is varicocele. Same bad quality embryo because of the varicocele in the testes. This looks good, but the capacity for implantation is lower. And also blastocyst capacity for implantation from embryos developed from fertilization of oocytes by spermatozoa from rats with varicocele is low. So what we would like to say, when all of us, we were medical students, what we learned in medical schools, the job, the mission of the sperm is to fertilize the oocyte. The sperm is a missile, brings the DNA, finishes. No, this is mistake. We men have a role beyond fertilization. The mission of the sperm, the job of the sperm is not only to fertilize the oocyte. The job of the sperm is to trigger, to explore the oocyte, to have a great capacity to invade into the uterus, to implant into the uterus. That's why the better the sperm quality is, the better the implantation rate is. So if a gynecologist say, hey doctor, I did 3 times 60, I put good quality embryos, but no pregnancy. Oh, by the way, he has varicocele. Say to him, take a textbook, study, refer the patient to an expert microsurgeon in andrology, and do varicocelectomy. So varicocele and varicocelectomy have an impact in the pregnancy rate, not only on sperm concentration, on sperm motility. And this is important. In many countries in Europe, and probably in Vietnam, the woman takes the man, go to urology, hello, we cannot have children. Okay, if you don't have children, you will go to urologist. You will never go to gynecologist in the beginning, because if you become pregnant, does not depend only on your oocytes, depends on your sperm. 70% of the protein synthesis in the blastocyst, the 5 days babies, depend on the male, and only 20-30% on the female. So before the couple goes to gynecologist, you should make public information. And I want to congratulate the group from Ho Chi Minh under the leadership of Professor Chung, which provides pioneer information in the citizens of the Socialist Republic of Vietnam for the importance to consult the urologist before the gynecologist, maybe. Oxidative stresses increases with low difference in temperature between testes, abdominal cavity. Testicular temperature increases, oxidative stress increases, lower capacity for pregnancy. But let's close with another idea. The sperm is a missile. Johnny now has sex with Mary. Is moving in the body of Mary. What does he bring? Okay, brings the DNA. Good. Anything else? Yes, it brings important factors. The centrosome. I see ladies in the room. I see males in the room. The centrosome, the organ that is responsible for the division of the cell, comes from the men in the human. All the ladies in this room, all the ladies in Earth have centrosomic material sleeping. It is the men material that is active, and varicocele may destroy the male material. So this is a second mechanism why men with varicocele cannot induce pregnancy easily. And also phospholipase S-zeta is an important enzyme to activate oocyte, and this comes from the sperm. If we see the embryonic development after good varicocelectomy and varicocele sperm fertilization, we study the blastocyst. This is a human blastocyst 5 days after sexual intercourse. If we have varicocele, the opening in the zona pellucida is very narrow. The uterus is here. The embryo wants to go out to the uterus, but the embryo has mechanical stress, cannot go out easily, and this affects the capacity for implantation. But after varicocelectomy, you see the opening is very big, and we have large capacity for implantation. So where is the implantation place? In the uterus. So today we challenge with research all the books should be rewritten. This is the message of Professor Chapel of European Association of Urology. We need research. Varicocele affects male body. Varicocele affects events that happen in the body of the woman. So we urologists are the appropriately trained physicians to provide treatment to the men of the Socialist Republic of Vietnam. They should go to urologists. Thank you very much.
Thật sự thì bữa nay những cái topic trong cái chuyện này rất hay. Thì có hai tình huống. Xin phép hội thảo cùng ban chủ tọa đoàn là sau một cái topic chúng ta hỏi liền hay là chúng ta để là cuối cùng. Tại cái bài của ông Eric Chung thì gửi video thì chúng ta có thể xem, nhưng mà có những cái vấn đề có thể trao đổi trực tiếp được. Thì xin ý kiến của thầy Quang, thầy Bắc cùng các anh chị là chúng ta thống nhất là chúng ta sau mỗi bài chúng ta có khoảng 3 câu hỏi để hỏi được không ạ? Tại vì đây chúng ta cũng muốn nóng. Ý của thầy Quang ạ. Dạ vâng. Dạ. Do you want to know about the question and answer now or after your present on present?
Excuse me, sir?
You want to have the question and answer now?
Now for varicocele. If you agree, you are the boss, Professor.
No. You already Ok, thế vậy thì chúng ta sẽ, vì những cái chủ đề này khá nóng, thì chúng xin rằng là chúng ta sẽ có 3 câu hỏi xong cái topic này. Dạ vâng, xin phép from Professor Minh from Huế.
Thank you so much for your beautiful presentation, Professor Nikolas. My question is there any way to evaluate steroid cell affected by a varicocele before we decide for the surgery?
So you mean before we decide for varicocelectomy, some predictive values? Yes. It is a very good question specifically for azoospermia, NOA, and varicocele. This is a very exciting question because Professor says if it is 3-5 millions, we will do varicocelectomy. But if it is azoospermia, so the way is to evaluate Mullerian inhibitory substance or androgen-binding protein, which are secretions by Sertoli cells. And the values of Mullerian inhibitory substance, inhibin, androgen-binding protein, which are markers of Sertoli cell function, give us a message if it is appropriate to do varicocelectomy in men with non-obstructive azoospermia. For the younger doctors, the European Association of Urology guidelines say less than 15 millions we go for varicocelectomy. But in case of azoospermia, it is a dark white area, and professor makes a very intelligent comment that if Sertoli cell function is good, yes, I will do surgery in a man with a non-obstructive azoospermia and varicocelectomy. Thank you.
Thank you.
Thank you for your very nice presentation, Professor. I would like to ask you that, according to your experience in your center, do you do the bilateral varicocelectomy or just unilateral?
Thank you very much. This is also a very difficult question because studies from Charlovich, Stuart Howard's group, Virginia, have shown if in men with left varicocele, you do right varicocelectomy, also together with left, you have better improvement. But this has not been included yet in guidelines. So we need a randomized controlled trials to answer this question. But your comment is very important. You have Jimmy, he has left varicocele, and also he has testicular cancer, left testicular cancer. You remove the testicular cancer, you expect, like usual people who have accident, to have more than 20 million sperm per ml. But he doesn't have 20 millions because he has left varicocele before cancer, and left varicocele destroyed right testis. So maybe in the new guidelines will be included, but not yet. Thank you.
Và chúng ta sẽ qua cái bài kế tiếp của Professor Eric Chung. Xin mời phía bên ban thư ký. Dạ vâng, thì nó vẫn tiếp tục cái lỗi thì có hình mà không có âm. Thì xin các bạn đợi 1 phút nữa, nếu không được thì chúng ta bỏ cái bài này thôi. Chứ băng thư ký. Phước. Nó không được thì 1 phút nữa stop. I'm sorry from the presentation from Professor Chung. He not work. He not work. Not my fault. So you can to present your presentation. Xin các anh chị chúng ta vô với lại là cái bài trình bày thứ 2 của giáo sư. Cái bài cũng rất hay về liên quan tới phẫu thuật và tinh hoàng ẩn.
Thank you. Thank you very much again to organizing committee, scientific committee, for giving to me the opportunity to be here today. And urology is surgery, urology is laboratory, urology is philosophy, and we will discuss. Urology has financial consequences when we think of this. And we will discuss today if Einstein, when he said nothing happens by accident, was correct. And Einstein was always correct. So why the testes from mesonephros descend at the 7th, 8th week to the inguinal canal, and then goes back to goes down to the testis? Which is the benefit? Why the testis is down to the scrotum? Let's see some different aspects on this trip. Important thing is the SRY gene expression. And SRY gene expression results in testis formation. And this rule is not always correct, because in 2 animals, and Volrat, there is absence of SRY and there is testis. So there may be other genes that give the biochemical messages for the generation of the testis. And I think all the young doctors understand this histological image. Hyalinization of the basement membrane, hyperplasia of Leydig cells, Sertoli cell-only syndrome is the typical Klinefelter syndrome image. But we say Sertoli cell-only syndrome. Have you ever seen spermatogonia-only syndrome? No Sertoli cells? Never. Because the generation of Sertoli cells and the secretory function of Sertoli cells is important for the descent of the testes. And Mullerian inhibitory substance secreted by Sertoli cells play a role. So again, Sertoli cells are important for testicular descent. And we know the SRY gene forms the testes, and all the clinical andrologists always evaluate AZF-A, AZF-B, AZF-C region before microtesse, because if there is complete deletion here, microsurgery is not recommended. It is the only reason the microsurgeon should not go ahead to do microsurgery. But again, the testis consumes much gasoline, much fuel, many calories to descend. Which is the benefit of this trip? many theories have been expressed. And when I was medical student, the most important theory was the temperature regulation. All of you in this room, you think that testis descends in the scrotum to have lower temperature than abdominal cavity in order testosterone biosynthesis to be appropriate, and second, to have spermatogenesis. But this is partial correct, not completely correct. So in this study from UCLA, they showed that in rats with high testicular temperature, varicocelized rats, one enzyme, 1720 desmolase, important for the testosterone biosynthesis, is decreased in function and activity. It means that the descent of the testis is important to regulate the hormonal levels and spermatogenesis. But somebody now, from young doctors, you listen the most clever comments, may say, Professor Sofikitis, you are absolutely wrong. Wrong, I'm wrong. Go out to drink a coffee. Don't listen to this lecture. Because this is the Asiatic elephant, no testis, and one Asiatic elephant in one ejaculation produces sperm like 8 people, 1, 2, 3, 4, 5, 7, 8. So this animal produces larger amount of spermatozoa per ml than 8 people. So what we say is mistake? No. There are always in science exceptions. The testis of the elephant is in high temperature region, but spermatozoa after the epididymis move to the ampulla, which is under a place in the retroperitoneal space of the elephant that has always a layer of cold air. So elephant has an air condition in the body. And the exception of elephant is that elephant has the testis in high temperature environment, but spermatozoa move immediately in 12 to 22 hours after generation in a place with air condition. Do they move quickly? Let's discuss it. We have ladies in the room? No, okay. We have, okay. One of the big differences between women and men reproductively is that the woman is born with 420 immature oocytes, and the woman has 400, 420, 50 menstrual cycles. But the man, after the beginning of puberty, produces sperm quickly. One day, 1995, we published in New York Times, in every heartbeat of a man, the heart of the man who is in love, toc, 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 toc. 8 million spermatozoa are generated if he's healthy. So the man produces 8 million spermatozoa in one heartbeat. Thinking in this way, move quickly, but in one heartbeat, elephant produces 1 billion spermatozoa. That's why sperm goes from this room to the other room with the air condition, because sperm wants to be cool. So elephant is an exception, interesting. However, it is very interesting that millions of years ago, it is considered that elephant has testes down, and then the testes became up because of the high external temperature in Africa. This phenomenon is called secondary testicodia, and we can see that nothing happens accidentally. Nature wants animals like elephant to have the testes into the retroperitoneal species. I come from a beautiful island near Mykonos. Maybe you know Mykonos, an island in Greece. Many Vietnamese couples go for honeymoon there. And in that place, we have farms with chickens. And have you ever seen testes in the turkey or the male chicken outside? Never. And maybe you will laugh. One male chicken in one ejaculation produces sperm like this 16 urologists. You 16 urologists, one ejaculation, one male chicken. And the male chicken has the testes inside. But let's see the testes inside, and here you can see many final nerve endings that give neurotransmitters all the night. So during night, you have an extreme dilation of the vascular system in the upper pole of the testis, and the chicken testis becomes like ice cream in the night and like a hot soup in the morning. But again, nature is very clever to keep the temperature regulation. Another theory appeared, and this theory says that if testicular temperature increases, the mutation rate of genes increases, and the possibility of malignancy increases. And this theory may be correct because men with cryptorchidis have higher possibility to become positive for testicular cancer. So maybe one benefit we have from testicular descent is lower possibility to develop testicular cancer. The third theory is the most exciting. The external position of the testis is attractive for the females and also is a signal of strength and dominance when the male animals compete who will be the chief of the group. You can see the chimpanzee, two large scrotums, two large testes. And this has an impact on the sexual life of chimpanzee. Same here, large scrotum, large testes. Very attractive for the females. Now, I see young doctors. If your girlfriend says you are a chimpanzee, it is the worst word. Please divorce her, because the chimpanzee is the animal which is the most unfaithful animal. 7 different females in one day, the chimpanzee. And the chimpanzee says, I am not bad. I want to be good to my partner, but my big testes are attractive for the females. And therefore, females approach me. And scientifically may be correct, because the gibbon, no testes outside. And this is the best character in the jungle. Gibbon only one female, never sex in pregnancy, and when the female dies, no other female. But the sexual life of the male depends, according to this theory and this anthropological zoological observation, from the absence or presence of the testes. And same with other species. No testis means monogamous life in jungle. Gorilla. If your girlfriend says you are gorilla, this is the best love word. It means the girlfriend trusts you, only one female in your life. Never sex with other females. But the gorilla has inguinal testes. And gorilla is not attractive for the other females. So the conclusion is species with external testes have polygamous life. Species with inguinal or cryptorchid testes permanently have strictly monogamous life. So if the female partner in animals wants to have, there are some species like the African chimpanzee, the female wants to have sex with many males during one day. So if the female has sex, chimpanzee 1 in the morning, chimpanzee 2 in the afternoon, chimpanzee 3 in the evening, who will be the father? There is a high sperm competition within the female tract. Marx, the well-known philosopher in politics, said everything happens to get money or to keep the DNA in life. These are the two powers for the men. And maybe same for the animals. So if the sperm compete from several males within the female, in order a male to become the father of the baby needs many spermatozoa. But many spermatozoa, large number of sperm means large number of seminiferous tubules. Large number of seminiferous tubuli means large testes. Large testes should be located in a large scrotum. So this is the conclusion. Female infidelity has, as a result, in the evolution of species, large scrotum. But if the scrotum is large, the male becomes attractive. So we have a cycle. Female character is not good, male character is not good in animal species. Another theory supporting testicular descent comes from Michael Benford from Cornell University. I remember I invited him in Japan many years ago. So Michael Benford said, I don't believe that the testes should be cold. And Michael Benford published this revolutionary theory in the American Journal of Anatomy. And what Michael Benford did, and all of us, we opened our mouth. Michael Benford took a mouse, cut under the scrotum. He didn't find testes. He found the tail of epididymis. And Michael Benford took a rabbit. He cut the lower part of the scrotum. He didn't find testes. He found the tail of epididymis. And Michael Benford went to the surgery in Cornell, professor of anatomy in Cornell, and when Mark Goldstein opened the scrotum, no testes. The lower, the colder point was the epididymis. So Michael Benford developed a very revolutionary theory. Testes go down as BMW, but BMW goes down in order to transfer the epididymis down, because epididymis should remain cold and then testes. And this theory is very attractive. And the example is lion. Lion is a very attractive in life animal because in one ejaculation, lion has 500 million sperm per ml. So lion starts the day, 500 million per ml, he has sex with a female, in the afternoon again sex, but in the second sexual intercourse, 300. In the third sexual intercourse, 50 million. And in the sunset, azoospermic. This is exciting. I took medical students in Japan and I published a paper. They had 5 sexual intercourses, very active students with the girls. They didn't study urology, but they had much sex. And first semen sample, 30, 25, 20, 10. The man never becomes azoospermic, even if he has 5 ejaculations in 10 hours. But the lion becomes. Why? Because the epididymis of the lion is in the inguinal canal. And lion is a cryptoepididymal animal. So Michael Benford is correct and should be well respected that it is important not only the testes to be in cold under air condition, it is important the epididymis to be under condition. And the last theory has an impact on sperm physiology, because if the testis is in the scrotum, testicular artery is very long, straight from the aorta on the left side. But if the testis is here, like the elephant, testicular artery is not long, it's short. Which is the result? Torsion is more often possible to occur here, long testicular artery, or here, short, long. So the higher possibility of microtorsions in animals like rat, rabbit, chimpanzee, human, gives a possibility from young days, the animal, to be trained in anaerobic glucolysis, microtorsions, low oxygen, pyruvate becomes lactate, Krebs cycle. So they have advantage. They have 2 ways to produce energy, the sperm, aerobic glucolysis, anaerobic glucolysis. But animals like the elephant and the chicken, with the testes up, they cannot have this possibility. If the testis is up, no microtorsion. So finally, to conclude, we can say that testicular descent gives advantage. Animals like rat, rabbit, chimpanzee, you, me, in Earth, having testis descendant, we attract females. We have better sperm motility because we have 2 ways, aerobic and anaerobic glucolysis. We have better epididymal function, higher testicular testosterone concentration, lower possibility for testicular cancer. I would like to thank very much HUNA and Professor Jung for giving to me the possibility to share some philosophy things with you today. Thank you.
Thank you, Professor, for presentation. Now you have we will have to answer because we don't have more time for the next presentation for Eric Chung. So we might have to stop presentation from Professor Eric Chung. And we had 2 questions for Professor Nikolas. Kính thưa toàn bộ các anh chị, thì hiện tại bây giờ chúng ta hết giờ rồi. Tại vì 16:30 là chúng ta phải hết session này. Và chúng ta có 5 phút để chúng ta clean up cái phòng để cho cái session phía sau. Một session phía sau cũng rất hấp dẫn là những cái kỹ thuật làm lớn dương vật và có những cái bài báo cáo rất hay của báo cáo viên của nước ngoài. Do đó xin phép chúng tôi phải dừng cái bài của Eric Chung lại. Cũng một phần vì lỗi của chúng tôi không có kiểm tra cái đường truyền tốt nên nó trục trặc ngày hôm nay. Bây giờ còn thời gian rất ngắn thì chúng ta có 2 câu hỏi. Các anh chị cố gắng có những câu hỏi liên về cái bài trình bày ngày hôm nay ạ.
I have a question. Thank you, Professor Sofikitis, about the philosophies of testis descent. For us to understand more about, for example, attractive females and for spermatogenesis and all this kind of. What do you think is which time of a man we should do to do the surgery to give the testis from under the descent go to the scrotum? Which is the best time? Yeah.
This is a very nice question. According to the European Association of Urology guidelines, after the age of 3 months old, there is no meaning to wait, because the second phase of testicular descent from the inguinal canal to the scrotum depends on testosterone. The baby comes now out of the uterus. Testosterone increases until 3 months. After 3 months, goes down until 10, 11 years old. So there is no reason to wait until 3 months old. However, because you belong to a very active group of azoospermia of Professor Jung, we discuss in EAU many times if non-obstructed azoospermic men, 30 years old, with cryptorchidism should be operated. And Professor Giverman from Lund has 7 Nobel Prizes in medicine in Sweden, says that even in adult with azoospermia, it may be good to descend the testes, and this is a new page, new indication for testicular surgery, because 1, we can diagnose cancer easier, and 2nd, psychologically, he and his wife feel better, and according to Professor Giverman and TAU, there is possibility some TSE negative men to become TSE positive men. Thank you.
Chúng tôi chân thành cảm ơn sự đến tham dự của quý đồng nghiệp, và vì thời gian có hạn nên chúng ta phải bỏ bớt một số bài. Chúng tôi cũng rất tiếc trong cái việc mà các bài trong thời gian hôm nay. Tuy nhiên trong thời gian sắp tới, những cái hội nghị sắp tới thì chúng tôi Hội Y học giới tính Việt Nam cùng với thầy Nguyễn Quang sẽ tổ chức lại một cái buổi và cung cấp lại những cái bài mà chúng tôi đã thiếu sót trong ngày hôm nay vào tháng 11 hả thầy Quang hả? Dự kiến vào tháng 11 thì chúng tôi sẽ có một cái hội thảo lần nữa về y học giới tính mà chuyên đề vấn đề này. Thì chuyện cái thứ hai thì chúng tôi cũng chân thành cảm ơn giáo sư đã đến và chia sẻ cùng với đồng nghiệp của chúng ta. Thank you very much for your presentation.
Thank you very